My name is Lisa Ryan, and I'm a pediatrician out here at Progress West Hospital. I work for BJC Medical Group, and our practice's name is Way to Grow Pediatrics. I think one of the great things about what I do is, I get to see you when you first become a family, and I get to see you through the years. I love talking to families about anticipatory guidance, talking to families about what to expect as their child grows. I love seeing that new mom come in kind of cautious and unsure, and then see her over the next, couple of months become, this well-assured mother who knows what to do and isn't nervous anymore and can handle things at home. And I just, it's just a lot of fun to see the babies grow. We see you a lot that first year, and then we just see you on a yearly basis, and just seeing, the kids and then the adolescents that they become, and that's real rewarding. I think as far as kids go, nutrition is probably one of the biggest things. Making sure our kids have a varied diet, making sure they eat fruits and vegetables and a wide variety of different foods, and making sure that they learn to do that at a young age. I believe that if you introduce a wide variety of different types of food to your child when they're young, you're going to build a healthy eater, you're going to build a non-picky eater, and I think that's real important for the rest of their life. We only have 2 physicians, myself and a partner. Anytime you come into our office, you're going to see a physician, and I think that's real important. You're not going to see a nurse practitioner, you're always going to see a physician, and more than likely you're always going to see your physician. We also are able to get same-day appointments. When you're sick, we're able to get you in. We have a real good relationship with Progress West. We are able to get you radiology on site, lab on site. Should you need to go to the emergency room, we're able to actually just walk you over there and talk to the doctor who's going to see you in the emergency room in person. Let them know exactly why you're there, what we think is wrong, and kind of what we want done. One thing we started over the fall was walk-in hours. So if you are up all night with your sick child and you're just worried to death, rather than waiting until our phones come on in the morning and calling in and hoping you get an appointment, what we have is between 8 and 8:45 in the morning, you just show up at our desk. We get everybody in the order that they come. If we are unable to get you in, if you come in after 8:45, you just get the first available sick appointment, and that has been, our patients love it. I have 3 kids. My oldest daughter was born when I was in medical school, so I guess I don't know any other way of doing this aside from having a child and having a family. And so I think that helps, that I just don't know any differently. It's just always kind of been done this way. I make sure that I have time for my family, and my husband is very supportive. My husband's a teacher, so he obviously has a little more convenient hours than I do a lot of the time. And we just make time for our family. We make sure we have dinner together every night. I think that's real important. I actually go home and I cook dinner, and we all sit around together and eat it, and we talk about our day. And on the weekends, we kind of devote a lot of that time to family time. Recently, I've taken a big interest in breastfeeding. I think breastfeeding is one of the best starts in life that you can give your baby, and I feel that we don't give our new moms enough support in breastfeeding. So currently what I'm doing is I'm actually taking classes. Once I'm done with all of these, I should be a certified breastfeeding specialist and eligible to take the actual exam to become a lactation consultant. But outside of all the official certifications, I can now provide that sort of support to my patients in the office. So when we have a new mom who has a new baby and she brings the baby in and expresses issues with breastfeeding, we can handle them right here in the office rather than sending her out to a lactation consultant. And I just think that's great. I think there's a lot of moms who they'd like to try breastfeeding, but they're not sure how it's going to go, and there's just not enough support for that out in the community, and so hopefully they can at least get that here in the office.